Look in the mirror right now. If your gums are red, puffy, or bleeding when you brush, don't ignore it. Your body isn't glitching. It's sending you a warning signal, and today, I'm going to decode exactly what it means, what's silently happening inside your mouth, and the 5 things you need to do in the next 48 hours before it gets worse. Stick around till the end, because reason number 4 is the one almost nobody talks about, and it has nothing to do with brushing. Here's something wild. Swollen gums are one of the top 3 early warning signs your body uses right alongside fever and fatigue to tell you something is wrong, not just in your mouth, sometimes in your entire body. So why does this happen? Let's break it down. Section 1. What's actually happening? When your gums swell, it's not random. It's your immune system going to war. Here's the science, simplified. Your mouth is home to millions of bacteria. Every single day, most are harmless. But when plaque, that sticky film, builds up along your gum line and isn't removed, certain bacteria multiply fast. Your immune system detects them as invaders and floods the area with white blood cells and inflammatory chemicals to fight back. That flood of fluid is what causes the puffiness, the redness, and sometimes the bleeding you see when you brush or floss. This early stage even has a name, gingivitis. And here's the part that should get your attention. Gingivitis is completely reversible, but left alone for weeks or months, it can progress into something much harder to undo. Periodontitis, where the infection starts breaking down the bone and tissue, holding your teeth in place. That's why catching this now, at the days ago stage, matters so much. Section 2. The 5 hidden causes. Let's go through what might actually be triggering this. I'm ranking these from most common to most overlooked. 1. Plaque buildup and poor brushing technique. This is the obvious one, but most people brush wrong. Scrubbing hard side to side actually irritates gums more than it cleans them. A soft bristled brush at a 45-degree angle, gentle circular motions twice a day is what actually works. 2. Vitamin deficiency, specifically vitamin C. Your gums are connective tissue, and connective tissue needs vitamin C to repair itself. Severe deficiency causes classic gum swelling and bleeding. If your diet is low in fruits and vegetables, this could be a real factor. 3. Hormonal shifts. This one surprises people. Pregnancy, puberty, menstruation, and menopause all cause hormonal fluctuations that increase blood flow to the gums, making them more sensitive and prone to swelling, even with normal oral hygiene. 4. Stress and a weakened immune system, the one nobody talks about. Chronic stress raises cortisol levels, and elevated cortisol suppresses your immune response. A suppressed immune system is less effective at controlling the bacteria in your mouth, which means inflammation can spiral faster than it normally would. If you've been under intense stress lately, and your gums flared up around the same time, that's not a coincidence. 5. An early sign of a systemic condition. In some cases, persistent gum inflammation is linked to blood sugar issues, since high glucose levels can feed harmful oral bacteria and impair healing. This isn't meant to alarm you. It's meant to explain why dentists often ask about your general health, not just your teeth. Now, before I tell you the exact 48-hour action plan, there's one mistake almost everyone makes when their gums start swelling. That actually makes it worse. I'll cover it right after this. Section 3. The mistake to avoid. The mistake? Avoiding the area completely. When gums bleed, the instinct is to stop brushing or flossing there because it hurts or looks alarming. But that allows plaque to build up even more in that exact spot, feeding the bacteria, causing the problem in the first place. The fix is counterintuitive. Gently continue cleaning the area. Softer pressure, more consistency, not avoidance. Section 4. Your 48-hour action plan. Here's exactly what to do starting today. Step 1. Switch your technique, not just your toothbrush. Soft bristles, 45-degree angle, gentle circles, twice daily, minimum 2 minutes. Step 2. Add warm salt water rinses. A teaspoon of salt in warm water, swished for 30 seconds, once or twice a day. It reduces bacteria and calms inflammation naturally. Step 3. Floss even if it bleeds a little at first. Bleeding when you first resume flossing after neglecting an area is common and usually stops within a week of consistent, gentle flossings. Step 4. Reassess your stress and your diet. Add vitamin C-rich foods, citrus, bell peppers, leafy greens. And if stress has been high, this is your sign to address it. Sleep, hydration, and downtime aren't optional here. Step 5. Know when to see a professional. If swelling persists beyond 1 to 2 weeks despite these changes, or if you notice loose teeth, persistent bad breath, pus, or fever. These are signs you need a dentist or doctor promptly. This video is educational, not a diagnosis, and a professional can identify exactly what's happening in your specific case. Section 5. Why this matters long-term. Here's the bigger picture. Oral health isn't isolated from the rest of your body. Research has increasingly linked gum inflammation to cardiovascular health and other systemic conditions, because chronic inflammation anywhere in the body doesn't just stay contained. So when your gums swell, your body isn't malfunctioning, it's communicating. The question is whether you listen now, while it's reversible, or later, when it's not. If this helped you understand what your body's been telling you, hit subscribe because next week, I'm breaking down the 3 warning signs your tongue gives you that most people completely ignore. Drop a comment below which of these 5 causes surprised you the most. I read every single one. Take care of that mouth, it's talking to you for a reason.